Before I begin, I want to quickly address the unplanned track work that Amtrak is currently performing in one of the New York tunnels, which will very likely impact this evening's commute for NJ Transit rail riders. Because of this work, NJ Transit trains are currently experiencing 30-minute delays in and out of New York Penn Station. And if you rely on NJ Transit this evening, take a moment to follow the Twitter account of the rail line you use, customize your push notifications on the NJ Transit mobile app, visit njtransit.com when in doubt, or call 973-275-5555. That's 973-275-5555 before heading to New York Penn Station this evening. All of these platforms, these not literal platforms, media platforms, will be able to get you real-time information so you'll know what to expect when you head to the station platform later today. NJ Transit is in close contact with Amtrak and will remain so until this unplanned work is completed. Until then, again, we ask everyone to keep up with current information, and we thank you for your patience. So, putting that aside for a moment, good afternoon, everyone. I'm joined immediately to my right by Health Commissioner Judy Persicelli. And by the way, I believe I'm actually going to officially swear you in tomorrow. How cool is that? Very cool. Immediately to my left, the Commissioner of the Department of Education, Dr. Lamont Repillette. All the way to his left, the Director of the Department of Homeland Security, Jared Maples, and to Judy's right, the Chief Security Officer at the Port Authority, New York, New Jersey, John Billich. Honored to have each of you with us. Today, we want to ensure residents that our state health authorities are on full alert for any possible cases of coronavirus and that we have in place strong preparedness protocols. And I want to be absolutely clear, we currently have no confirmed cases of coronavirus in New Jersey and no persons under investigation. So we're not doing this reacting to some burgeoning challenge in New Jersey. We are doing this in light of the global reality and to let folks know what our level of preparedness is, what we're doing to try to get out ahead of this, God forbid, if it in any way, shape, or form gets out of hand. But we stand before you calm, cool, and collected, but we want to make sure we've given you the information you need. I think there was one patient under investigation, one or two? One under investigation, but the CDC informed us yesterday that the individual was negative for the virus. However, we are not going to let our guard down. New Jersey is, after all, at the international crossroads, home to global businesses and research and educational institutions, and with proximity to any number of international airports and other points of entry. The Department of Health has shared with hospitals across the state specific guidance for evaluating reports of patients exhibiting coronavirus symptoms, including the taking of a full travel and potential exposure history, which is a crucial metric when determining whether a patient meets specific criteria for CDC testing. We will continue our close partnership with both the CDC and other appropriate federal agencies to expedite testing of any potential coronavirus cases. Again, let me reiterate unequivocally, there are currently no potential cases of coronavirus pending. But should a potential case present itself, our healthcare practitioners and hospitals will be ready to handle it swiftly and properly. The Department of Health has made, as you'll hear from Judy in a moment, has made all of its information available via its website, which is nj.gov/health, and Judy will get into that in more detail, nj.gov/health, and has also opened up the state's toll-free public hotline for any questions that residents may have. That number is 1-800-222-1222, 1-800-222-1222. Please don't get these numbers mixed up and call that number looking for your train at Penn Station. We are working closely with officials at the Port Authority, John is here, which operates Newark Liberty International Airport, to ensure that any passengers who may have been exposed to coronavirus are properly screened so they do not pose a threat to the public at large. We're all hearing the same news reports about the growing number of coronaviruses and cases internationally. I myself have lived in the People's Republic of China in the Special Administrative Region of Hong Kong. And I think when you combine, as I said to a few of the reporters here earlier, the potential lethal elements of this virus with, I think, I will say charitably, an uneven response on the government side, which is what we saw in China, that is, which is what we saw in some prior instances. This is in an abundance of caution that we're coming to you today to try to get out ahead of this. We all read the same news reports, and we could draw the same conclusions. However, we should all be mindful that the steps that we are taking here, which are being replicated across the country and in multiple cities around the globe, are meant to isolate cases to protect the public. And we will not shy from our most vital responsibility, ensuring the public's health and safety. And with that, I'd like to ask the Commissioner of the Department of Health, Judy Persicelli, to speak some more on the department's preparedness program. Judy.
Thank you, Governor. And thank you for holding this briefing. I'm joined today by Dr. Lisa McHugh, who is our Program Coordinator of Infectious Disease Epidemiology, and Chris Newark, who is our Assistant Commissioner for Public Health Infrastructure, Laboratories, and Emergency Preparedness. You know, although this novel virus is understandably a cause of concern, it is important for New Jersey residents to know that the risk to the general public remains low. Coronaviruses in general are quite common and are a frequent cause of respiratory illnesses, such as the common cold. However, sometimes a new type of coronavirus appears and it begins infecting humans, which is what we are seeing now. This type of virus has never been seen in humans before. Currently, there are 5 confirmed cases in the United States. The first one was in Washington State, a little over a week ago. There's a case in Illinois, Arizona, and 2 in California. All these individuals had traveled to China. The CDC said that right now there is no spread of the virus in the United States. The department is closely monitoring this rapidly evolving situation and working across our agency and state government to strengthen our preparedness for this novel virus. The New Jersey Department of Health works with hospitals and local health departments throughout the respiratory virus flu season, which we are in the middle of. Along with our partners, we will be prepared to respond to any surge in this virus. Yesterday, we held a conference call with 250 hospitals and local health officials to keep them updated on the latest information we are receiving from the CDC. We provided an overview of the Department of Health guidance for evaluating and reporting possible coronavirus illness and appropriate hospital infection control procedures. I've also sent a letter to all of the CEOs in New Jersey, the CEOs of the hospitals, to reinforce this guidance so that individuals can be evaluated appropriately and cared for. Additionally, we held briefings for all of our cabinet members, and all of our elected officials were invited to a briefing yesterday afternoon that included both federal and state officials. We were also notified yesterday that the CDC has begun screening at 20 airports, including Newark Liberty International Airport. The screening at the airport consists of having travelers answer a health declaration form with both a symptom check and a travel history, including travel to Wuhan, China, and potential exposures while traveling. In response to initial reports of the outbreak in Wuhan, China last December, the Department of Health convened an internal preparedness and response team, which is meeting regularly at this point daily and monitoring the situation with the CDC and the Association of State and Territorial Health Officers. As you know, we are in the height of the respiratory flu season. Many individuals are in emergency rooms with respiratory virus symptoms, but there are particular criteria that need to be met for an individual to be considered for testing for the novel coronavirus. The screening criteria, the questions that need to be asked, have been endorsed by the CDC and are being used by all hospitals in the United States. Patients with confirmed novel coronavirus have reported mild to severe respiratory illnesses with symptoms of fever, cough, and shortness of breath. CDC believes at this time that symptoms of this virus may appear in as few as 2 days after exposure to as long as 2 weeks after exposure. Our coronavirus website, which you can find through our homepage, nj.gov/health, has frequently asked questions, fact sheets, and guidance for hospitals and for schools and universities. To ensure the public has access to factual information and to alleviate fears and dispel rumors, we have opened a call center, 1-800-222-1222. This free hotline is available 24 hours a day and is staffed by trained healthcare professionals who can accommodate callers in multiple languages. Over the past 24 hours, we have received more than 100 calls from the public. The 3 top concerns are, am I at risk? What to do if I have had recent travel to or from China? And school and classroom concerns. At this time, only the CDC laboratories in Atlanta have the capabilities to test for this virus, though it is expected that soon state public health laboratories will be able to test. The Department of Health Lab in West Trenton is ready when a diagnostic test becomes available. We have instructed all hospital labs on the safe handling and transport of specimens, and depending on the volume of activity, we expect turnaround results from the CDC within 24 to 48 hours once they receive the specimen. Again, as we are in the height of the respiratory virus season, I want to remind everyone to take basic steps to prevent respiratory illnesses by practicing good health habits such as covering coughs and sneezes with a tissue or a sleeve, washing hands often throughout the day, and going to see your doctor if you do not feel well. New Jersey continues to work closely with the CDC and local health partners to monitor this situation. Thank you.
Thank you, Judy. Well done. It's one of the features of our new location for Newark press conferences is we have a flat screen television, in fact, with the website on it right there. So you didn't get that in the other building, Lamont. Please now help me welcome from the Port Authority of New York, New Jersey, the Chief of Security, John Billich. John, good to have you.
Thank you, Governor. The coronavirus screening assessment effort is being led by the CDC and CBP, and that is currently underway. The Port Authority, Newark Airport's operator, is committed to assist our federal partners in these efforts in any way possible. As we have done in the past, collaborative protocols have been established for this effort between the CDC, the CBP, the New Jersey State Police, the Port Authority, and local and state health officials. Our role thus far is that the PAPD will assist New Jersey State Police in the medical transport off airport in instances where further evaluation is required. In these instances, our personnel will utilize appropriate personnel protective equipment. This will be done ramp side to ensure the safest and most direct route off the airport. Also, if needed, additional screening space has been identified and prepared for use, and additional personnel protective equipment obtained if needed. Signage both in English and Mandarin will be disseminated through all aviation terminals. The signage is displayed as a health warning and describes the symptoms of the virus and the need to seek medical care if you have traveled to China or have had other international travel. Lastly, communication flow between all federal, state, and local partners is constant to ensure that situational awareness of this rapidly developing health concern is accounted for. Thank you.
Thank you, John. Well done. Judy mentioned in the top 3 concerns of the calls that you were getting was what about schools? And I think we all felt that it made a lot of sense to hear from our Commissioner of the Department of Education. Please help me welcome Dr. Lamont Repollet.
Thank you, Governor. Good afternoon, Governor, everyone. We recognize that schools are a crucial component in communicating information to families. The Department of Education is taking 3 immediate steps. 1, we are issuing a broadcast message to every school, district, charter, and Renaissance school in the state. The broadcast will provide important resources and information from the New Jersey Department of Health and the Center for Disease Control. Number two, we will utilize the power of our social media to distribute information to parents, educators, and students. Again, this will be done in collaboration with state and federal agencies. And finally, we are reaching out to all of our stakeholder groups who represent teachers, principals, superintendents, school boards, and PTAs. A key part of this will be to directly work with the school nurses, their association. We want to hear their concerns as we rely on their knowledge and expertise as dealing with this in schools. They may have key recommendations that we may not think of. New Jersey has faced many outbreaks and viruses over the years, and we know the vital role that schools have in providing information to students and families are important. It is our role, the Department of Education, to serve as a conduit to supply school information with the necessary information they need to keep our families and our kids safe. Thank you.
Well done.
Thank you, Governor.
Thanks, man. Thank you, Lamont. Would love to conclude before we take a couple of questions with the Director of the Department of Homeland Security, Jared Maples.
Thank you, Governor.
Pleasure.
Good afternoon. Throughout these entire events, we've been in constant contact with our partners, Department of Health, the State Police, OEM, the Department of Education, and everywhere in between to ensure that we have the most up-to-date information and can support with any coordinative roles that are necessary. In addition to that, we've conducted private sector outreach through our Domestic Security Preparedness Task Force to ensure that critical infrastructure partners are aware of the most up-to-date information, particularly those that have travel to China and to the East Asian region. And that's been our role, and we're going to continue to stand by and support. Thank you.
Thank you, sir. With that, we'll take a couple of quick questions here. Please. Brian, long time. No, you, yeah.
Okay.
Yeah. Brian, long time.
Yes, sorry, Governor. I was busy yesterday.
That's I was not.
For the health commissioner,
Please.
could the WHO today says there is a grave concern that this will spread beyond China, not just the 95 worldwide cases now, but presumably an outbreak. How on the mark do you think they are or are not in expressing a grave concern?
That's really hard to say. We've been tracking the different algorithms that the CDC uses and epidemiologists use to track the spread of disease, and we've gotten 3 different results. Some that say it might be mild and some that say it could be widespread. I'm going to ask Dr. McHugh, she's our expert, if she would mind coming up.
Lisa.
And Dr. McHugh is the person we rely on at the Department of Health, and I can't thank her for enough. She's been working 24/7 on this.
Thank you.
Thank you, Governor and Commissioner. So what I would simply say is that these are novel viruses, and often we don't know, much like many folks ask us to predict the influenza season. They are very challenging to predict. I think that it's safe to say that we are ready and willing to respond to something regardless of whether this becomes mild or severe. What we've learned from other novel coronaviruses like SARS and MERS is that sometimes they cause these very large outbreaks in areas and then they fizzle out, and maybe we see some sporadic cases here in the United States. And in other circumstances, these take hold and can create a large number of illnesses. And so what I can say is that we don't really know entirely where this will go, but I can say that we are preparing as best as we can for either circumstance as it might present.
Thank you, Lisa. I would just repeat something I said because they've all forgotten more than I will ever even hope to know about the science. But it is a data point that is troubling, which is probably part of the reason why we are trying to get as prepared as we are, is that it's in China. And China has an explicit, uneven history in dealing with these things. Please.
For those of us who've had a flu shot, are we less, more, or does it really matter what this means?
I am certainly not the person qualified to answer this. So, Lisa?
So again, this is a novel coronavirus. So influenza and novel coronaviruses are very different. So while we at the department would certainly encourage everyone, if you haven't already gotten a flu shot, to certainly get one. It will help protect against the influenza, which we are currently in a very high season right now. But unfortunately, a flu shot won't help you in these circumstances. But what will help you is that if you're familiar with dealing with influenza and the common practices that we recommend for any respiratory virus, as the commissioner had said, wash your hands, symptoms. Make sure you're practicing good respiratory hygiene, covering coughs and sneezes in either a tissue or your sleeve. And if you're sick, stay home from work, and then contact your healthcare provider to provide you guidance on what your steps are to do next.
Thank you. Nikita.
So this is a little bit off topic, but we're kind of getting started into the party convention season, and I'm wondering, do you think that the Democratic Party should hold conventions for their primaries?
In the state of New Jersey?
Yeah.
Haven't given it much thought, honestly. I know I've literally read a couple of items. I haven't had any real intense or frankly any political conversations about it. So bear with me on that one. I'll come back to you. Thank you. By the way, repeat, my late mother in heaven, wash your hands. She would be very mad at me if I didn't say that. Not related to the political convention question, Nikita, by the way.
The station called several times yesterday to the hotline and we couldn't reach anyone. Is it working properly?
We've received over 100 calls in the last 24 hours, so I don't know when it was switched on and when you called. But as far as we know, we're not getting complaints that people are not getting through.
Can I make a suggestion before you leave? Judy, can I ask you a favor? Can you two go into one of the
Sure.
offices here at the EDA
And we'll
and try it and call?
Absolutely.
1-800-222-1222. 1-800-222-1222. Sorry.
Commissioner, if you could take us through what happens if you get a patient. Does a hospital need to clear a floor? What happens?
So a patient presents in the emergency room, or if a patient presents in an urgent care center or a physician's office, and they fulfill criteria of having traveled through China or having been in China, we're asking, particularly the physician's office and the urgent care centers, mask the patient and send them to the local emergency room. Call the emergency room and advise them that you're sending a patient over that could fulfill the criteria for a person under investigation. When the patient shows up at the emergency room, they're immediately triaged. They should be placed in a negative pressure room. If the emergency room does not have a negative pressure room, they're to be placed in an isolated area, isolated room, and all personal protective equipment should be used. The patient should be masked, airborne, droplet, and contact isolation procedures should be initiated. This, as far as we know, spreads like other respiratory diseases, like the flu, like measles. So protecting yourself totally, including we're asking the personnel to wear eye protection in case there's droplet transmission, and you do not have to clear the emergency room. You do not have to clear a floor. We believe that negative pressure rooms, or if you don't have negative pressure rooms, complete control of the respiratory infection through masking and isolation in private rooms could work.
So how easy or difficult is this for a hospital?
Most hospitals are very well prepared. The infection preventionists at hospitals know these procedures. They're very well prepared at this point to handle any patient that presents.
Let's do one more, if that's okay. Everybody else
Can I get
over here?
Ron to ask the question since you're at ground zero?
Yep.
Like, how do you, what are you, just watching flights from China, watching people that are connected through China? Like, what if they didn't go through
So that,
LA or maybe Seattle? What do you do?
sure. So that's a function of the CBP. They are Customs Border Patrol. They scrub their travel data for. We have no direct flights coming from Wuhan, which was the original focus. We do now have 29 flights that come weekly from Beijing, Shanghai, and Hong Kong on a week.
Are those all where do the old Kennedy?
No, those are all to Newark.
So 29 in Newark, and what do you have at Kennedy?
We have something a little more than that. I believe it's 39
Okay.
in total. But a lot come to Newark, certainly.
But not from Wuhan.
But we did have direct flights in Kennedy that had since been canceled from Wuhan. So it's scrubbed the Customs Border Patrol. They look for any nexus back to Wuhan, and then they go through their series of questions and a temperature check for those individuals that they have concern about. And to date, we have not. There hasn't been one suspicious case within the Port Authority airports.
Maybe do one more. We're gonna have to wrap it down.
For the commissioner, do you agree with experts' assessment that it's actually the flu that remains much more of a threat than coronavirus?
I can only tell you at this point what we know. In New Jersey, we have documented 3,600 flu cases, and we've had 2 pediatric deaths. Nationally, we've had between 15 to 21 million infected flu cases, and 20,000 deaths, 54 child deaths. So the flu is very virulent, and in New Jersey, we're on high alert for the flu at this point.
Thank you, Judy. Thank you, John. Thank you, Lisa. Thank you, Judy. You two will get together and give it a shot. And Lamont, Jared. One of the again, 1-800-222-1222. One of the promises we'll make, whether it's a press conference, I'm not sure, but as we learn more, as we learn more, we will make sure that we're over communicating on this, as long as this remains a health concern. So thank you all very much. Thank you. Thanks, guys. Matt, Aliana, Mahan, John.
Thank you.
Thanks,
Good
buddy.
to
See you,
We'll
pal.
see you in a week, I think.
You betcha. We
Yeah,
will.
that's
We're
great.
at our place.
Yep, yep.
Come here. That's the point. Give us 1 second. This location, look at this. This cannot work. Who does this? Is this? Okay, it's got to be up. You got to have it as up the podium as possible. Make sure all your colleagues have it.